Hello and welcome to this screencast of the OmiHealth Clinic Management System Alpha Demo by Team Omicron, Team Number 5. My name is Matthew Santana. Joining me for this demonstration is Franco Schwim, Kevin Lang, and Dane Lang. In this video we'll be demonstrating our system to you, which includes our website and mobile platform solutions. We'll be guiding you through both project platforms by providing you with a normal clinic-based scenario. So without further ado, let's get started. I will now be demonstrating how a patient is able to self-register themselves online by connecting to the website from a computing device. In the top right of the web page, you can see a button to self-register a patient on the system. By clicking this button, a patient's self-registration form will load. The prospective patient is then able to fill the form with all their particulars in an ordered manner with each important section. When the patient clicks to submit the data, this registration form contains features such as password strength checking as well as validation of required fields. At this point, we'd like to mention that all data sent to the database is via parameterized queries in order to prevent SQL injection attacks. From this point, I'll be changing my role as a patient to that of a staff member to demonstrate the OmiHealth Clinic Management features. I will now be handing over to Franco, who will be demonstrating the role of a clinic admissions clerk.
Okay, thank you, Matthew. Now I'll be logging in as an admissions clerk, as Matthew mentioned. From this page, as you can see on the left-hand side, only admission clerk menu is active, as I only have privileges to be an admissions clerk. Okay, now I'm going to accept the pre-registered patients that came into the clinic. Here we will be able to search for the pre-registered patient. There's two currently pre-registered patients. We're going to select Maria, the one we're working with. All the details will be filled into the form that the patient input in the previous form they entered. The admissions clerk can then confirm these details and correct anything if needed. The clinic number should then be given to the patient, as this number will be used at all the different points within the clinic. Like if they visit the doctor now, for example, they would need to give that number, which will be used to search for them. The details will be saved. The patient then will be activated on the system. When the patient is activated, a pre-admission test will always be done when the patient comes to the clinic. We just input test data here. All the information will be added accordingly. There's also a couple of screening questions that will be asked. This will help the doctor and nurse at a later stage to make a faster and more effective diagnosis. The details will then be saved, and then the patient will move to the next process within the clinic, which will be the nurse. This process will be explained by Kevin.
Thank you, Franco. I'll now demonstrate how a staff member is able to use the OmiHealth mobile system. The patient has now had their pre-admissions test done, and the patient is now told to either see a nurse or a doctor depending on their individual circumstances. In this instance, the patient will be directed to a nurse. This is the role that I'll now be demonstrating to you. To allow doctors and nursing staff to be able to use the website, as well as the mobile application, all functionality is present in both platforms. This allows doctors and nurses to make house calls by bringing along their tablet PCs and increases usability of the system. At this point, the patient has already been to the admissions clerk, where a pre-admissions test has been completed. I'll now demonstrate an observation as performed by a nurse, but first we have to search for a patient. Once a patient has been searched for, we can click on the observation menu. On this page, we can see the latest pre-admission test for the given patient, and on the right, the various observations that can be made. Clicking on a single condition will allow the nurse to then further insert details of that condition. Once a nurse has completed all observations, they can then click on the Submit button. This will save the observations for the patient. I'll now log out and change my role to that of a doctor to demonstrate the adding of a diagnosis. We will now search for the patient. Now we can click on the diagnosis menu item. As you can see, the pre-admissions test and the observations that were previously made for the patient will be displayed for review. The doctor will now fill in the general diagnosis and a detailed description thereof. Upon clicking on the Save Diagnosis button, the diagnosis will be stored for the patient. I'll now be handing over to Dane, who will also be playing the role of the same doctor, where we will demonstrate adding a prescription for the patient.
Thank you, Kevin. As Kevin mentioned, I will continue playing the role of the doctor and will now be demonstrating to you how a doctor can prescribe a treatment and view a patient's medical history. On the main prescription page, you can see a summary of the latest pre-admission test completed for a patient, as well as a prescription history for that patient. This page contains two boxes that hold the medication and treatments that are to be prescribed. First, I will select medication to be added to the prescription. On the left of the page, you can choose medication to be added. In the center of the page, you can specify further information concerning the medication to be added. On the right side of the page will be a list of the medication to be added. When adding new medication from the database, one has to search for it using its barcode number, name, or presentation. Once selected, its information will be moved to the center of the page, where information about the dosage, the frequency of dosages per day, the total duration of the prescription, as well as choosing whether or not the medication is chronic, and adding a comment. Once the user clicks on Add, the medication will be moved to the right-hand side of the page, after which more medication can be added. Once the user is finished adding medication, they will click on Done, and it will navigate them back to the prescription page. In this page, you will see that the medication has been added to the list of medication to be dispensed. At this point, the user may also choose to add a treatment to the prescription. The user will enter the name of the treatment and a description of what the treatment entails. Once the user clicks Done, the application will again navigate to the main prescription page, where the user can choose to send the prescription to the pharmacy. I will now demonstrate the View Medical History functionality. This page will be populated with a list of days that the user has visited the clinic. Once the user selects a day, they will be able to see a variety of information concerning the patient's visit to the clinic. The patient's pre-admission test, diagnosis, observations, prescribed medication and treatments for that date will be summarized on this page. I will now be handing over to Matthew to demonstrate the Pharmacist functionality in our system.
Thank you, Dane. I will now demonstrate how a pharmacist will dispense medication by logging in as a pharmacist on the OmiHealth system. From this point, I will load a patient by searching for them using the Search for Patient control. The pharmacist will then click on the Dispense medication from the Pharmacist menu. The pharmacist will then be presented with a list of all the prescriptions available for the active patient. Clicking on a prescription will navigate the pharmacist to a page where they can review all the waiting medications as part of that particular prescription. At this point, the pharmacist will physically hand over the medication to the patient, followed by clicking on the Confirm Dispensary button. After clicking on the Confirm Dispensary button, the processed prescription is removed from the available prescriptions of the patient to prevent a reissuing of medication as shown on this page. In summary, you have now viewed a typical process a patient will follow when moving through the clinic, from registering, being activated on the OmiHealth system, having a pre-admission test done, followed by observations, diagnosis, and finally a prescription being issued and dispensed. This concludes our demonstration of the OmiHealth Clinic Management System. Thank you.